Good morning.
Hello.
How's everyone? Yeah, did you have a good night last night? Brisbane 2032. Is everyone ready to go? Okay, well, in fantastic news for Queensland, we have no new cases of COVID-19 in the state in the last 24 hours. That means we're down to just 26 active cases. Our total number remains 1,761. We continue to see a high level of testing, which is fantastic, 16,675 tests, and we're really excited to report that we passed 2 million vaccines in Queensland, a credit to our fantastic health workers and, of course, every Queenslander who has come forward to get vaccinated. We can also report that the contact tracing for the two most recent cases infectious in the community, the student who travelled from Melbourne and the 12-year-old boy from last week, has been very successful. There are now 358 close contacts from the Melbourne student, 316 close contacts of the 12-year-old, all now safely in home quarantine, home or hotel quarantine. We have not seen any further infections, which the Chief Health Officer reports gives her a level of confidence that we've identified the highest risk contacts from those two cases and put them into quarantine safely, into quarantine away from the community, which gives the Chief Health Officer, and she has advised us, a level of confidence that those risks have been managed, and we want to be able to, tomorrow, ease as many restrictions as possible here in the southeast. And so from 6 a.m. tomorrow, whereas at the moment there is a restriction on gatherings of up to 30 people, that will increase to 100 people in homes, with no limit for people gathering in outdoor public spaces. Indoor premises, this is the hospitality density rule, will go from 1 per 4 square metres to 1 per 2 square metres. We'll be able to lift some of the restrictions on visitation at hospitals, aged care and in disability care. Weddings are currently restricted in the southeast to 100 people with 20 dancing at one time. They will be able to increase to 200 people with an unlimited dancing, provided people comply with the 1 person per 2 square metre rule, and funerals will also increase from 100 to 200. As I say, we really want to be able to ease these restrictions safely, but we can't ease here without greater assurance, greater protection from the risk of people travelling from other states with the virus into our state. And so we need to be able to reduce that risk. We've seen in recent days ongoing escalations in case numbers and numbers infectious in the community in New South Wales, increases in case numbers in Victoria, and escalations in South Australia also. Thanks to the lockdowns currently in place in Victoria, South Australia and Greater Sydney that we have reciprocated, our border is effectively closed to those people already. But in order to be able to ease these restrictions, as I've outlined, we need to close the border to the rest of New South Wales. That will mirror the arrangements currently in place in Victoria, South Australia, Western Australia and Tasmania. There will be a border zone in place for people who live and need to travel within the communities around the border. So the X-Pass that those border communities will be familiar with will be available and allow that travel for essential purposes. It will extend south to Clarence Valley and west to the South Australian border. It will allow people to move around those communities for essential reasons, all of the things that you would expect, things like to go to school, to go to work, for healthcare or to care for others. The border zone won't include Coffs Harbour. There are some risks there that the Chief Health Officer is concerned about. Police will be installing checkpoints at key locations along the border, and the Deputy Commissioner will outline those. In the southeast, in order to be able to lift these restrictions, even though it's less than 14 days from when we had someone infectious in the community. The Chief Health Officer has asked if people can continue to wear masks for 7 more days. Masks have proven effective at allowing us to mitigate the risk of those infectious cases. So continue to wear masks at all times that you're around others, except for when you're seated, eating and drinking, or strenuous exercise. We've seen in Victoria some cases of transmission, the first real cases of transmission within a stadium, and so the Chief Health Officer has also recommended that we bring in some additional restrictions for stadium events, for large stadium events where people travel great distances and have large crowds. So for those stadiums with a capacity of greater than 20,000 seats, they will now be capped at 75% of their capacity. That's in part recognition of the sheer number of sporting events currently being held in Queensland, with those additional NRL and AFL matches being played in the state. There will also be more stringent requirements around the wearing of masks, even while seated, except when eating or drinking. As I say, this recognises the risks associated with a large number of people travelling distances and congregating, particularly on their way in and out. Can I say that our stadium staff and our stadium management have done a fantastic job at managing the current COVID-safe restrictions, a really good job. This doesn't reflect on them at all. This is simply in recognition of the risks that we've learned from other states. The Deputy Commissioner will also outline how our quarantine capacity is currently stretched. We have 2,995 people in hotel quarantine and 5,365 total Queenslanders currently in quarantine, and of course it's possible that the extension of these border restrictions will add to that pressure, although I'm pleased to report that we have seen more compliance in the heavy vehicle industry. You'll recall we were concerned about that over the weekend and early in the week in response to a joint police operation that recognised the risk associated with freight after the removalist from Sydney that travelled into Victoria. And I'd really just underline to that entire freight and logistics industry what a responsibility they have, what a responsibility that comes with the exemptions that they are provided, and urge them to continue to be vigilant in that compliance. Thank you.
So very good news that we have no new community-acquired cases. We didn't have any yesterday or today, which means that our contact tracers have had the opportunity to really get in there and find all of the close contacts of our most recent cases and have them all now in quarantine. So should any of them become positive, which is still possible for the 14 days, of course, they're already isolated. So that is a fantastic piece of work by all of those people. I'll just go through the numbers because they're quite astounding. So there are 358 contacts related to that student healthcare worker who came up from Victoria. There are 316 contacts related to that family who returned from Sydney. And there are 382 contacts related to that positive case at the airport. So the job has been done to find all those people and get them into quarantine, and now we'll be monitoring them very, very carefully. We have currently 1,770 people in home quarantine and a total of 5,365 people in quarantine across the state, which is critical. So I thank every single person who's in quarantine. It is really, really important. You do not leave your home for any reason, unless of course there was a terrible emergency, a fire or something like that. Other than that, please do not leave your home. You've been fantastic. You're keeping everyone safe. I know it's an impost, but it's so important. If you need help, please ring 134 COVID and they will sort out if you need any groceries or medical assistance or pharmaceutical items. please just stay where you are. That is so important. We know that most of these people, in fact all of them, it would be that Delta variant. And we know that there is very little forgiveness with that virus. It will get out any chance it can. So that is critical. Now, because we have all of these people in quarantine, and I'm reasonably comfortable we've found the people we need to find, and also because we are tightening up our border, we are seeing, unfortunately for New South Wales, ongoing escalation of their risk down there. We're seeing more cases in their restricted local government areas that they've locked down, but we are also starting to see cases come out of that area while infectious into other parts of the state, such as Coffs Harbour, such as down in the south coast. We've seen positive sewerage results in Bowral. It is really starting to escalate. It's important that we increase the restrictions on New South Wales. So therefore, as of 1 a.m. tomorrow morning, all of New South Wales is declared a hotspot, which then means that people cannot enter into Queensland from anywhere in New South Wales except for a few exemptions. So of course, Queenslanders returning home, but they'll be going into hotel quarantine. People who have exemptions for various reasons, again, will go into hotel quarantine. And then there is that border zone that we've put in place. Now, it is really important that people in that border zone, if they go south out of the border zone into the rest of New South Wales, they won't be able to come into Queensland for 14 days until they left that other part of the state. But if they've only been in the border zone, then there will be a number of permitted reasons that they can cross into Queensland. And they're the ones that they're used to. They're for education, for school, for university, for work, for healthcare, any form of healthcare, for essential shopping that they can't do locally. And that will vary. I mean, people who are in Tweed, of course, they've all got local shops there, they can manage that. But if you're out towards the South Australian border, there mightn't be shops, and the closest ones are in Queensland. So for essential shopping. Not for social reasons. So not to come to restaurants, because we know that restaurants are higher risk. Not to come to cinemas, not to come to football matches, those sorts of things. So I'm positive that the people in the border zone are fully aware of the types of things that it would be sensible for them to continue to cross the border, and the things that they'll just have to forego while New South Wales gets their outbreak under control, and we can be sure that we won't have risk of spread coming into Queensland from parts of New South Wales. So that is really important. And then it's great to see the restrictions will ease from 6 a.m. tomorrow, but I have asked that for an additional week, could people please wear their masks? We know that has protected us. I am positive that the reason we've not had community spread recently is because people have been genuinely wearing their masks. So for the next week, I just want to up that use a little bit so that we wear masks at all times, unless we're in our own home or in our car with members from our household, or doing strenuous exercise, so we really can't wear a mask because that would be a risk to our health. Or we're under 12, although I've seen a lot of kids wearing masks. That's a good thing. If kids would like to wear masks, that would be great to see, but there isn't any requirement to. Under 12, we don't require to wear masks. And then, of course, if anyone has any medical contraindication, so respiratory disease or so forth, that would compromise their health, then they don't need to wear a mask. But for the vast majority of people, I'd like you to wear masks at all times. And particularly, this is a change, so this is really important. When you go into stadiums, until now, I've said once you sit down in your seat, that you can take the mask off. I now need you to keep the mask on the entire time you're in the stadium, unless you're seated and eating and drinking. Then you can take the mask off while you're eating and drinking, but then pop it back on. And the reason I'm asking for that is because we've seen a number of transmission events happen in Melbourne, in stadiums, outdoor events, and they've had transmission. So I think we do need to up that requirement. And I've also asked all of our stadiums that have 20,000 or more seats to limit the numbers to 75% capacity. And the reason for that is that we know with our stadiums throughout Queensland, people can often come from a long way away, go to the stadium and then disperse. So it's a real risk. As we've seen in Victoria, the reason they've had to close down their entire state is because of the risks that came out of one of their stadiums and then those people going back home in regional Victoria. So I'm just asking for the next month, while we work out where our risks are, that stadiums decrease their ticket sales to 75% capacity and get all of their patrons to wear a mask at all times, except when eating and drinking, and they must be seated to eat and drink. Thank you.
It is because of the amazing work of Queenslanders, our contact tracers, our COVID testing staff, the pathologists, that we're able to act quickly, get these results and be able to contain the virus. So I want to thank everyone for doing the right thing and following the rules. That means that as of 6 o'clock tomorrow morning, other than mask wearing, the whole of Queensland will be on the same level of lower restrictions. That means businesses across the 11 local government areas in southeast Queensland will be able to go back to 1 per 2 square metres. More patrons coming in their doors, and we know how important that is for business. It also means that people will be able to visit their loved ones in hospitals and aged care and nursing homes again in southeast Queensland. We're so pleased that this can occur. Obviously, anyone who is a close contact who is required to isolate or someone who has been to a hotspot are prohibited from entering those sites, but anyone else can now go visit loved ones again. You can have more people in your home, more people at weddings, more people at funerals again. The only thing we ask of you over the next 7 days, if you are still in those 11 local government areas, is to wear your mask even more now. If you are seated in a stadium anywhere of any size, keep your mask on unless you're actually eating and drinking. If you are in a cinema, if you are in a theatre, please have these masks on at all times unless you are vigorously exercising. That really is the only time, other than taking it off to eat and drink, that your mask should be off over the next 7 days to ensure that we keep everyone safe. And of course, we're changing the rules for our largest stadiums to come down to 75% capacity at the moment. We are able to do this because we are going to reduce the risk of further transmission across our borders by closing our borders to New South Wales other than that border zone. The border zone will cover 17 local government areas of New South Wales that will be eligible to come across into Queensland's border for permitted reasons. So as the Chief Health Officer said, for work, for education, for school, for childcare, to care for a loved one or a vulnerable person, whether it's paid or unpaid. These are the reasons for essential shopping. These are the reasons you're allowed to come in. For Queenslanders going into that border zone, you'll be able to come and go, but remember you should still have a travel declaration so we know where you've been, because if there is a transmission in any of those local government areas on the border, we need to be able to contact you and let you know whether you are a close contact or not. For the 1,770 people who are now isolating at home in Queensland, we say thank you. We know you'll do the right thing. We need you to do the right thing. This is about keeping you safe, your family safe, and the whole community safe. If you need any assistance with groceries, medicines, anything at all, call 134 COVID so that you can continue to be isolated for the required period and making sure that everyone stays safe. So thank you, Queenslanders, for the great work. It was great to see so many people wearing their masks as they celebrated last night with the exciting announcement of the Olympics for 2032. I know that we will keep doing the right thing, and that means that we can continue to have our economy open at a time when half of the country is in lockdown. The numbers that we are seeing interstate is very concerning, but we can do what we are announcing today because of the great work of all Queenslanders. Thank you.
Morning. I'll start with our road borders, and as you've heard, we're moving to a different posture as of 1 a.m. tomorrow morning, so the checkpoints will be back. The point I have to make about that is exactly what we've had to tell you in the past for our community, is that when we first implement this, it does get very congested, it does get very difficult, and we're asking all of the community to work with us through this. Pack your patience, make sure you have the right passes, but realise that once we implement this for a period until it settles, we will see some congestion and delays. So please work through with us on that. With respect to those borders, of course, as you've heard, people will need to make sure that if they are Queenslanders and they can get back out of an area that's not currently a hotspot, they should really do so today. If they come through tomorrow and they're coming out of a hotspot, they can be expected to put into hotel quarantine. And as the Acting Premier said, our hotel quarantine is under pressure, so it would be very good for us to see all those persons that should come home and can come home, that come home before that 1 a.m. deadline. With respect to that too, as you've heard, there will be a cross-border area. Please bear in mind that these systems do take time to change, that with new directions we have to put in new passes and new systems. That is underway. There may be some delay in getting the new pass completely completed. That will mean that people can still travel on the existing pass. So when they get on the system, the pass that is on there, they can use that. They need to understand what the directions are, and we will assist them to work through that if there is any issues. In our operational area, you've heard about masks, so they are not going away. We really do need the community to continue to do the right thing. We are still seeing some people not wearing masks. We handed out 39 yesterday, so please, for the next week, make sure you have your masks, you carry them, and you wear them. At our borders yesterday, we intercepted 1,881 vehicles. We turned around 6 and we put 1 person into quarantine. At our domestic airports, we processed 1,462 passengers, refused entry to 6 and placed 109 into quarantine, and we saw 212 international arrivals into this state. On our heavy vehicle operation, we intercepted 133 heavy vehicles. The compliance is improving, so to the trucking industry, to the truck drivers themselves, thank you for listening to the message and improving, but we need you to continue to do that. The non-compliance started at around 36%, it's down to 13% now of those not having the appropriate passes. So whilst it is improving, some are still not doing the right thing. And indeed, we had to issue 4 penalty infringement notices to truck drivers yesterday for failing to have the appropriate paperwork. And in one incident, a very concerning incident, the truck driver drove at police and has been charged or is being investigated for serious criminal offences on the Darling Downs. So we need people to cooperate with police when they're doing their job, not make it more difficult for them. We also saw 2 breaches of our border controls where people failed to declare when they came in, and they've been fined $4,135, so serious consequences. And we had 1 person attempt to escape hotel quarantine in Brisbane via the fire escape, but was caught before they got out, and they've been fined $1,378. So the message there to everyone is, whilst we will work with the community to make sure that we all comply with the Chief Health Officer's directions to keep us in their safe place, there are serious consequences for those that willfully do the wrong thing. Thank you.
No, we're not at this stage, but people should reconsider if they need to travel to the ACT. The ACT, as we all know, has done an excellent job at keeping COVID out of their area, and it's a long time since they've had a case, and they have border restrictions in place. So at this stage, we are not closing to the ACT. Yep, but as soon as you need to eat or drink, you need to be seated, and then you can take your mask off. Depends on the dance. Yes. Yes. For the next week. So this is just to protect us for 1 further week, because although we believe we've found all of the contacts, because Delta can spread with seconds of exposure, there might have been some that we've not picked up, and we know that masks have really added to our ability to mitigate the risk.
Are you able to clarify where exactly
Yes, there's a map on our website. So down there are the LGAs down, including Clarence Valley, and then it's essentially a straight line of LGAs going over to Broken Hill. So you'll be able to look on our website would be the best way of explaining it to people.
Why are you comfortable with still having movement between those areas?
Yeah, because Sydney is facing stay-at-home orders, so people in Sydney shouldn't be moving more than 10 kilometres from their home. But we know that there have been some people, particularly freight and others, who've gone outside of Sydney. And we have seen now that positive sewage detection at Bowral. We've seen New South Wales being forced to lock down those 3 LGAs around Orange. We've seen those that case that was up in Coffs Harbour, a construction worker, that's a significant risk there. So, but we haven't yet seen any cases, except for one very early one in Bourke when the sewage tested positive, but it rapidly returned to clear. We haven't seen other issues along there. So at the moment, I am comfortable for that border zone. Because remember, most people who live in that border zone actually have a far closer relationship to Queensland than they have to Sydney. They tend to come up to Queensland for a whole range of reasons that are everyday part of life. School, university, work, healthcare, caring for, they often have families. Often there are split families with parenting requirements just across the border. So that's why, as we've done in the past, we're maintaining that border zone. But we'll be very, very cautious and we'll keep a very close eye on what is happening there, of course. Yes, from 1 a.m. tomorrow, yes.
And how long do you expect it might stay in place in these things? Given how things are looking down south, it's been in place for quite some time now.
I suspect we'll be reviewing it in a month's time, but if things rapidly turn around, of course we'll review it earlier. If things don't turn around, it could well be longer. So people should be prepared for the next month, would be my advice to them.
In terms of development in Victoria, what we consideration back another month as well?
No, they've got fewer cases, and today's cases, they had 26 and they were all in quarantine, so we might be able to look at Victoria much earlier than that. But we'll just keep on doing this. This is a day-by-day process.
Deputy Premier, do you think the Premier should go to the opening ceremony in Tokyo?
Well, the International Olympic Committee have just granted Brisbane one of the biggest honours in the world, the chance to host the world's biggest event. And I think what the Premier said is that she never intended to offend them or offend anyone. And I think given what they've said and John Coates has said, I think she should go. Look, I know that John Coates and the Premier are very close. They have a very strong relationship. I think what you saw was just how strongly the IOC feel about the opening ceremony, and I think what the Premier said, that she certainly never intended to cause any offence whatsoever. After the IOC has just granted us the thing that we asked for, the chance to host the 2032 Olympics here in the southeast. I think there's a pretty robust relationship there between the Premier and John Coates, and what was said simply reflects the way they were feeling about that matter. And I think, having heard what they had to say, I think that's a pretty strong perspective. I think we're taking it very, very seriously. This is an incredible honour for our city. I'm incredibly proud that we've been able to win those hosting rights for the Olympic and Paralympic Games in 2032. I don't think there's any way, Lydia, you could consider that we haven't taken this very, very seriously. I believe she'll be back at the weekend.
That's being investigated. So the important thing, thank you for reminding me about the importance of vaccination. Today it is more important than ever that any Queenslander who is 60 years of age or older immediately, if they haven't had their first dose of AstraZeneca, which is about 30% of people in that age group, please go and get that first dose. That is becoming really important. I don't know when we'll get our next potential outbreak of the Delta variant. We can see that the risk is just escalating. So to protect our most vulnerable, please, if you're 60 years of age or older, go and get your first dose of AstraZeneca. Anyone who's had one dose of AstraZeneca or Pfizer, please go and get the second dose at the right time frame. 12 weeks for AstraZeneca, for 3 up to 6 weeks for Pfizer, because you need both doses. So get the 2 doses as soon as you can. For people under 60, you're at less risk of getting severe disease, which is a good thing. But as soon as possible, when we have got Pfizer vaccine available, please come and get it. So there'll be information updated regularly on our website when there is Pfizer vaccine available. Thank you. Yes. Yeah. Of course, people should, whenever they're concerned about their health, it doesn't matter whether it's vaccines, it doesn't matter if it's anything else, the best person you can talk to is your own GP. And for anyone in Queensland who doesn't have a GP, now is genuinely the time to find one and develop that relationship. It's critical.
That roadmap we saw from the federal government in terms of fully vaccinated people being exempt from further restrictions much further down the track. Do you think that message is getting through to people who have vaccine hesitancy that if they don't get vaccinated, they will be still subjected to these restrictions?
It's a bit hard to discuss vaccine hesitancy when, to be blunt, we don't have enough vaccine to offer people. So that's why I'm saying if you're 60 years of age or over, please, for your own sake, come and get vaccinated, because we don't have enough vaccine available for the whole population to be able to mitigate the spread and the risk of spread of the virus, particularly this Delta variant. So it's too early to talk about vaccine hesitancy when people just can't even access it. No, the investigation's ongoing.
So she hasn't been interviewed yet?
I don't know. It's an ongoing investigation and they'll complete it when they can.
Health Minister, do you know whether she's been investigated?
What I'm aware is that I'm expecting the report to be completed by the 6th of August. So I will leave it to the investigation as to when they're interviewing any one individual involved in this matter, but there is a report due to me on the 6th of August.
Are you aware of any of the findings so far?
No, I'll just...
Will that be released, shortly after that date?
the Premier has given a commitment that that will be publicly released.
Are you disappointed that the Labor government won't tell us, the federal Labor opposition won't commit to changing the laws on that?
Look, I'll be keen to continue to discuss that matter with federal Labor. I noted in your report they'd simply not commented or not responded. So that's not them saying they won't do it. I'll be keen to keep engaging with them and in conjunction with the other states that have now legislated to provide for voluntary assisted dying for their citizens who are suffering at the end of their lives.
It's not a very good sign that they won't even respond to questions.
I'm not going to reflect on what their motivations might be in those circumstances. I'm keen to keep talking with them about it. Keen to keep talking to the current government about it. I mean, at the end of the day, they're the government and they're the people who could move now, either by changing the law or by providing some direction from the DPP. Well, Brisbane does everything better than Sydney, and so I have no doubt whatsoever that Brisbane 2032 will be even better than Sydney 2000.
And can you assure regional Queensland that they won't miss out on any funding over the next decade as that progresses?
Yeah, we can. The Premier's been very clear that, first of all, this will be a Games for the whole state, and that throughout that period we'll continue to deliver, as we always have, infrastructure right throughout Queensland. It's probably better for either Jeanette or the Health Minister. Jeanette?
One of the reasons you can cross from the border zone is healthcare, or to visit a vulnerable person to provide care to. So they won't need exemptions to do that. Now, the population of the rest of New South Wales is actually not that large. So we already have all of those restrictions in place for that extra greater Sydney, if I can describe it that way. So the areas beyond that are not that much. So I don't see that there'll be a significant increase in exemptions. But yes, we can flexibly increase and decrease the staff as we need in that area. I don't know how many there are today because it might have been increased from yesterday. It does genuinely increase and decrease depending on what the need is. We'll get up to 100 or so. Yeah.
That will depend on a lot of variables, but can I just say we've done this before, so we have a well-executed plan. We will do the physical things such as getting the barriers in over the next period. We've practiced this, we've done it, and we'll assess that against risk and traffic flows in terms of how many people we need to do that. We've already got a fairly significant number committed to the current random interception operation and the heavy vehicle one. So, look, we'll be fine. We'll deal within it. Of course, it's extra work for us, but we also know that we're going to see reduced flows once the restrictions kick in. Yes. Yeah, look, we are looking into that, but don't expect anything to get concluded while she's in quarantine. So until she's completed her quarantine period, we won't be interviewing her, so it'll be a little while before we sort that out.
Does this kind of concern at all about that maybe some of these borders that are linked to interstate exposure sites are a little bit hard for people to follow?
Look, without going into the details of that particular case, because I haven't been fully briefed on it, my understanding is it's pretty clear and that most of the jurisdictions are very proactive in advising people once they've been exposed and identified. I know we are, and I'm pretty certain that Victoria are as well. So, but look, the onus is on the individual, and the system can't be that hard because for 5.5 million people in the COVID pandemic over the last 18 months or more, we've seen less than 3,000 people where we've had to take action. So overall the compliance is very high because people do understand it and do the right thing. I don't know her personal background, so I'm sorry. Thank you.